In our center, we have been treating varicose veins non-surgically for about 20 years. The first thing is to identify the refluxing vessels, as I told you before, and treat this vessel with either laser ablation or radiofrequency ablation. These procedures are done under local anesthesia and under ultrasound guidance, and they are the alternative of the old surgical technique, because in old surgical technique we remove this vessel, but in the new ablation methods we put a catheter into this vessel and we destroy the inner surface of the vessel by heat with radiofrequency or laser. They are equal in terms of efficiency. And after this destruction, our body's natural defense system is activated, and the vessel starts shrinking by time. And after 6 or 7 months after treatment, we cannot see this vessel even with ultrasound. So the result is the same as surgery. So this vessel will go away, but we can do it through tiny needle holes by using our body's own defense system. So this is the first part of our varicose vein treatment. We must do laser ablation or RF ablation to the refluxing vessel. And the next stage is the treatment of the varicose veins. For the treatment of varicosities, we use different methods. If the varicose veins are too large, we can use ambulatory phlebectomy or miniphlebectomy, which includes the removal of large varicose veins through tiny needle holes. And we do this procedure also under local anesthesia. And if the patient has medium-sized varicosities, the best technique is generally ultrasound-guided foam sclerotherapy. And we put some needles under ultrasound, and we inject foam into the vessel to be treated. And the foam also destroys the inner surface of the varicose veins like laser, but not by using heat, but by using chemical destruction. These vessels also will shrink by time and will go away in some months. If the patient has very tiny varicose veins, which are called spider veins or reticular veins, then our treatment of choice is microsclerotherapy. So we use extremely tiny needles, like 33 gauge or so, and by using a light magnifier, we put the needle into spider veins all over the leg and inject a very diluted and very small amount of sclerosant material into the vessel. So this is very effective, and in our experience, we can achieve 90%, 80% reduction of spider veins in 2 sessions. But our sessions are generally long. They take about 2 hours, and during these sessions, we can make maybe over 100 small punctures. This is important because for an ideal microsclerotherapy, the number of punctures must be high, but we must inject very diluted and very small amount of sclerosant material to have a very good result and to reduce the risks.